The topic of physiotherapy commonly comes up in reading, listening and writing papers in the OET exam, even if you're not a physiotherapist. So in this video, we want to show you how you can prepare for this. Let's take a look. Hello, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means you are in the right place for your OET. Be sure to check out our website and see how we can help you pass your exam. Don't forget to subscribe to our YouTube channel and hit the bell so you're the first person to know when we upload a new video. Let's go! So, even if you're taking the test of medicine or nursing, you might come across physiotherapy in the OET exam. For example, a consultation with a physiotherapist in listening A, a presentation or interview with a physiotherapist in listening C, or perhaps text related to physiotherapy in the reading paper. In writing, you might have a referral letter to a physiotherapist, and there might be reference to physiotherapy in the speaking role play. Having knowledge of what's involved in physiotherapy can help you prepare for the exam. It's important to become familiar with vocabulary and read about this profession in your self-study. Let's take a look at what's involved in physiotherapy. Let's take a look at when physiotherapy is used, using an extract from the NHS website. So, physiotherapy can be helpful for people of all ages with a wide range of health conditions, including problems affecting the bones, joints and soft tissue, brain or nervous system, heart and circulation, lungs and breathing. Physiotherapy can also improve your physical activity while helping you to prevent further injuries. So what vocabulary do you know relating to physiotherapy? Let's take a look. Mobility aids. Keep it in a straight or bent position, above the level of your knee, hip. Lift, bend, stretch, pull. Strengthen. Put weight on. Stop it from becoming stiff. Reduce any discomfort. Use crutches. These are all phrases which you might use when discussing physiotherapy. Now have a look at this text from our course Reach OETB. We can see that there are several useful words relating to physiotherapy. Post-operative exercises, mobility, body functions, manipulation, relieve pain, respiratory physiotherapists, clear secretions, and breathing exercises. Read from a variety of sources to build up your vocabulary for physiotherapy. Learn the spelling of common words and phrases, so if in listening A you have a consultation with a physiotherapy, you are prepared. Here is a text taken from the NHS website. Now, quickly scan for any words or phrases relating to physiotherapy. So what did you find? We have lots of useful phrases here. Posture, lifting or carrying techniques, prevent injuries, movement, tailored exercise, physical activity, mobility, strengthen, manual therapy, relieve pain and stiffness, hydrotherapy, aquatic therapy. Doing activities like this can help you prepare for the reading and listening papers, which can be on any of the 12 professions. By reading about and preparing for physiotherapy, we can see how it might help you during the listening paper. For example, here's an extract taken from our course, Reach OETB. Learning vocabulary related to physiotherapy helps prepare you for the listening and reading papers. It's possible you will have to write a letter to a physiotherapist in the OET writing paper, or report physiotherapy interventions. Understanding the scope of physiotherapy can help you to understand what relevant information to include and which information is irrelevant. So, what things would be relevant to include in a referral letter to a physiotherapist? You would want to include brief details of the accident or operation, the reason why the physiotherapy is needed, anything related to mobility or range of motion, also any occupational therapy interventions such as mobility aids, and anything related to physiotherapy sessions given or needed in the future. Look at this task. You are the charge nurse at Shippington Community Hospital where Mr. Jones was admitted on the 21st of February after a fall. Using the information in the case notes, write a letter to the community physiotherapist, Mr. Tim Jenkins, requesting physiotherapy home visits for Mr. Jones. So we can see we are writing to the community physiotherapist who will visit Mr. Jones at home for physiotherapy. What information would it be relevant to include in this letter? The patient's name and age is relevant, and of course, what happened. However, the social background of the patient does not relate to the care the reader will provide, physiotherapy, and so should not be included. The past medical history is also not relevant to the reader, or even this particular medical issue. What about hospital treatment? Information about the pain on admission and the X-ray are not relevant. This happened before the operation and does not relate to the reader's role in this case. Details of the surgery is relevant. Information about medication and wound monitoring is not relevant. This is something that the physiotherapist would not be involved in or need to know. And details of all the hospital physiotherapy sessions are not essential. The earlier sessions are no longer relevant. Focus on the most recent range of motion, which is relevant. Similarly, a history of the patient's mobility during recovery is not needed, but his current mobility is relevant. Now let's take a look at the discharge plan. What do you think would be relevant to include? Okay, let's take a look. The most important information and the action you want the reader to do is the physiotherapy sessions. So any details of this are essential. Since more physiotherapy might be required after the surgeon's review, the date of this appointment is also relevant. Although this is not being performed by the reader, it is useful information for them to know, so I would include it. However, the monitoring of medication is not something the physiotherapist would be involved in, and therefore it is not relevant. So in preparation for your exam, you can practice writing example sentences which you might write if you have a referral to a physiotherapist or you have to write about physiotherapy intervention. Here are some examples. Mr. Mills was reviewed by the physiotherapist and achieved 3 out of 5 power in his left leg in his third and final session. He has been compliant with the exercises and is gaining confidence when using crutches. He will attend physiotherapy sessions twice a week for 6 weeks at the outpatients. It would be appreciated if you could provide physiotherapy to support Mr. Smith's mobility. Top tips for physiotherapy. Understand the kind of work that a physiotherapist does. This will help you specifically with the writing paper and prepare you for the listening and reading paper as well. Read extensively. Use reliable sources to read about common conditions and popular topics and articles. And develop your knowledge of vocabulary relating to physiotherapy and practice using it in context. So what words and phrases did you learn about physiotherapy today? Let me know in the comments below. Be sure to check out our website and see how we can help you prepare for your OET exam. We have the perfect course for you. And if you want to see more videos like this, be sure to click on the information icon at the top to view our playlists. See you next time. Bye! Hello, I'm Jo. It's recording. Let's take a look at what you can do. No. Learn the spelling of common verbs. So if you have a physiotherapy consultation in a listening A paper,